doctors aren't Batman. We're not going around saving lives as individuals. It's not our individual uniqueness that makes us effective. It's the fact that we're working with other people, the fact that we're part of a team that makes us effective. Hi, my name is Dr. Rich Hillsden. I'm a general and trauma surgeon, and you're watching Knife Skills. So today I wanted to do a bit of a reaction video to Dr. Ali Abdaal's video about how he's quitting medicine for good. I actually saw a video of another doctor YouTuber that mentioned this and reacted to a component of this. And there were a few things he said that I actually did fundamentally disagree with. So I did want to actually react in my own way to this video. I haven't actually seen the video before, but maybe we'll just go through it together to kind of get a sense of how I feel about this. So first of all, let's take a look at Dr. Ali Abdaal's website here. So the first thing I noticed on the website is that he calls himself a junior doctor. And I think it's pretty important to understand. That's a real different experience than a consultant or an attending physician or surgeon like myself. When you're going through training as an intern or resident or junior doctor in the case of the UK scenario, there's a number of factors. Your income is lower. You're really under a sort of a pressure cooker environment because you're being trained still. You may be a doctor, but you're really just in the middle of becoming who you are as a physician. The stress level is high, the pressure is high, the autonomy is low, the respect is less. There's a lot of challenges. And of course, they're there for a reason. We need to be challenged to become who we can potentially be. And so I would say right off the bat, someone who's making a decision to quit medicine in the middle of the training experience, although it's not uncommon, it's something I want to encourage anyone who's watching this video to do is just stick with it. Get through your training. You have time to do something different if that's what inspires you after you're done your training. But get through it. Become who you can be as a doctor. Get to that point where you can see who you are and what your potential truly is before you give up on medicine altogether. The other thing I noticed as well from this is that he has 2.54 million subscribers. So clearly this is someone who has kind of won YouTube. Even Dr. Mike has only about 8 million subscribers. As far as I know, he's probably the most famous YouTube doctor. I'm thinking about Z-Dog as well as another doctor I follow. He's awesome. I don't even think he has 500,000. So Ali Abdaal, with 2.54 million subscribers, truly is a professional YouTuber. It's in my mind, he's actually more of a YouTuber clearly by looking at this than he is a doctor. Not to take his training away from him by any means, but if you think about the focus that it takes to become that successful as a YouTuber, clearly that's where his mind is most of the time. Okay, so let's load up the video. This is the opening here, and we'll just scroll down to go through a few comments here. So this one says, it means a lot. Someday I'll tell you why. Maybe this person's contemplating leaving as well. All the power to you. You've clearly thought through this. Love the video. I'm also planning on leaving medicine to pursue entrepreneurship. And again, all the power to these people who choose to do that. The moment you said, well, if you're a medical student and you want to unsubscribe, that's totally cool. I felt touched. And clearly this person's saying that there's a lot more to the channel than just being a doctor channel. And I appreciate that. This one says, I'm at a breaking point. Everything's so overwhelming. Being a doctor was never for me. But because of income problems, I had to choose med school. I'm in my third year and I can't stop thinking I'm spending my youth doing a job that I don't want. Really common feeling here. And I think he's related to people who are in medicine who are struggling with some of their decisions, no doubt. Thank you so much for vulnerability. I graduated med school and is burnt out. So a number of comments really talking about how people can relate to that decision. So I guess now that I'm into this review or reaction, my feeling here is, I think as someone who's been through it and has had those feelings of burnout, had those feelings of doubt, had those feelings of imposter syndrome, that I want to just encourage anybody who's listening to my channel, if you're a medical student or someone who's aspiring to be a doctor, that you can do it. I think I should probably even share some of my journey about how I became a doctor at some point on this channel, because it's been up and down as well. But without further ado, why don't we get right into it, and actually I'll put the headphones on here and we can get a more up-to-date reaction here.
Right, so I have been agonizing about this for many, many months, but I think I'm finally at the point where I can comfortably admit to myself and to you guys that I'm gonna be leaving medicine for good. So in this video, we're gonna have a little bit of a chat around the thought process behind this decision. And we're gonna talk about some of the main factors that came into it, like the fear of...
Clearly he's got some timestamps lined out. And I think this is more or less his analysis of why he's quitting medicine. So there's something to do with money, something to do with fun, helping people, purpose, meaning, social status. I can see kind of where he's going here. Interestingly, there are a lot of things that are missing from this, as far as I'm concerned, that would be important to becoming a doctor. That should be part of your motivations. For example, the purpose, meaning, helping people. There's a lot more to that. So we'll see what he has to say as we move forward.
About leaving medicine in the middle of a pandemic, the fear of spending 8 years going through med school and working as a doctor to then quit medicine, the fear around, will anyone still continue to care about my YouTube videos if I lose this badge of prestige of being a doctor? We'll talk a bit about how I'm getting over the fact that I'm now a selfish twat for leaving the medical profession and saving lives for the sake of making these silly internet videos. And we'll talk a bit about how things like money, fame, fulfillment, status, and impact, and helping people, all of that.
Okay, so he made a comment here that I'm leaving the medical profession and not saving lives. Really interesting perspective here, because I just want to say, as a trauma surgeon, I'm in a field where lives are at stake, but I definitely do not define my value as a surgeon on lives saved. There's no scorecard that I keep as a surgeon about lives saved. And I think that's really important to understand. Saving lives might be this motivation you might have, maybe. The reality of practicing in medicine is a lot more than saving lives. So caring for the individual person, and that ability to connect with an individual and provide value to their life. You can do that in many other ways in medicine, of course. But I think defining it as saving lives might be very narrow from the feeling of a surgeon.
Kind of ties into this decision. So this is going to be a quite long and quite rambly video. It's probably not going to be useful directly. It's not like a listicle of how to be more productive or things like that, but I'm hoping that if you're interested in the thought process behind the stuff, if you're at the crossroads of making a big career decision in your life as well, or maybe even a life decision, you might find some of the mental models that I've been going through maybe helpful, maybe not. I don't know. Let me know in the comments whatever you think either way. All right, let's start with part one of the video, which I guess is taking a step back, zooming out a bit, and thinking about what is the purpose of work. And the way I see it, there's broadly 5 different things that we work for the sake of. The first one is money. We need to work to make money. The next one is having fun. The third one is helping people. The fourth one is some combination of like purpose and meaning and that kind of stuff. And the fifth one, which is a very sort of unsexy thing that we probably won't admit to ourselves, is social status associated with the job that we...
Okay, so he made a comment about social status being an important part of your job and why you might do that, and said that it's unsexy. I think that unsexy is maybe, I can understand what he's trying to say here. We should actually start to own it. The reality is that we should own the fact that we have motivations. It's okay to have some selfish motivations when it comes to work. Trust me, the financial aspects when you're doing a job that you want to get paid, that is selfish. That is meant for you. It's okay to have rewards for you in the job that you do. That's okay. And sometimes that's social status. Sometimes that means there's some opportunities to maybe connect with people. Maybe there's opportunities to do different things that are exciting. Maybe you make your parents proud because of the social status that you have from the job that you do. That's okay. Where I would say it becomes a problem is if any one of these things, he says money, fun, helping people, purpose and meaning, if any one of those things is the sole reason why you do a job, you're actually probably not picking the right career for you. You actually will want to have your career really kind of hit all 5 of these points. So I totally agree with him there. I think it should be knocking those things off in all areas. Your job should make enough money for you to sustain you, to live the lifestyle you want. You should enjoy your job, at least parts of it. Maybe not 100%, but at least 30% I would say you should enjoy. The job should have some role potentially of helping people. I would say that all economic activities by their very nature should be helping people. That's how the economy works. If you're not contributing to society by not helping people, you're not really doing anything of worthwhile. Purpose and meaning, that's something you're going to get from yourself. Again, you're going to feel good about the helping that you're doing, about the role you're playing. And again, social status is totally reasonable, as I mentioned.
The money thing. So obviously we all need money to survive, and money is a big part of why we go to work, 4 things. Bear with me, I'm kind of going zoomed out here, but I want to kind of keep these 5 things in mind as to the point of work as I talk about the decision to leave medicine ultimately. So we all need money to survive, and as Vicki Robbins would say in the book Your Money or Your Life, which is very good, people should read it, she would argue that actually the only thing we get from work is money. Yes, we get other things from work. We get these things that we're talking about, fun, helping people, purpose, meaning, social status, all that kind of stuff. But she argues that we can get all of these things if we just volunteer. Like, you can get fun and purpose and meaning and social vibes and fulfillment and all that kind of stuff from volunteering at your local church or helping out with a charity without getting paid for it. And the only thing that makes it work is the fact that you are being paid for it. So that's like an interesting way of seeing the money thing. And obviously for some people in the world, like, the only reason they are going to work is to make money, and having fun, helping people, having meaning, having impact, that kind of stuff. It is all like a privilege once you've gotten to the point where you've ticked the box of, okay, I'm making enough money from my job to make ends meet.
Okay, so I'm going to disagree a little bit here about this idea that work is only money and you can get all the other things by volunteering. I don't think Elon Musk or Jeff Bezos at that stage in their careers are looking at their involvement in their organizations as, oh, this is just another paycheck. It's very much not the case. When you're functioning at a top tier level, for sure, there's outside motivations. In fact, even an author is going to be disingenuous because the slog of writing a book may or may not be worth it on the money front alone. Oftentimes, your job needs to take you above and beyond money, because although I think it's really important to be professional and that you earn an income from the work you do, very often we will find ourselves in our lives feeling, the money isn't really worth the money. And we are looking for those extrinsic values outside of money to motivate us. And I think for being a doctor, that's very important as well.
Is not a factor for continuing to be a doctor, because in the UK, doctors don't get paid very much. And the sort of money that I can make doing this YouTube thing is astronomically higher than the sort of money that I could feasibly be making as a doctor. Now, this is obviously a super privileged position to be in. Most people don't really have that option where they can just quit their job because they've got the option for making more money further down the line, but that is something that ties into it. But then people always say, well, okay, being a doctor isn't just about the money. It is also about the other stuff associated with being a doctor. And the reason we go to work is not just for money, it's also for fun, satisfaction, helping people, professional intellect, like learning, all of those kind of reasons, which ties into these other 4 things that we're going to talk about. So the next reason as to why we go to work or why we have careers, if we ignore the money thing, is to have fun. Maybe fun is too simplistic a word. Maybe you prefer the word satisfaction or enjoyment or pleasure or anything like that. I like the word fun because it really, I don't know, it's kind of simple. I like simple words. And there's a few different types of fun that we can get in the work. For some of us, the work that we do is genuinely fun. Like, intrinsically, we enjoy the work so much that it is actually fun going to work. For some of us, the work itself may not be inherently fun, like going through a spreadsheet is not inherently fun, but the banter that we have with our coworkers and the good vibes and the fact that all our friends are at work, that's what makes it fun. For some of us, it's the fact that work is an intellectual challenge. This is a nice thing within medicine. It is quite an intellectual, and there is some element of lifelong learning. You get to improve your skills, you get to be better, you get to have a sense of progression. All of these things add up in various ways to give this kind of concept of fun, that I enjoy my job, I enjoy my work. And honestly, when it came to my decision to leave medicine, the fun bit was like a pretty large one, because I genuinely did enjoy the job. Like, it was quite fun. I enjoyed the banter with the coworkers, I enjoyed talking to patients, I enjoyed learning the science part, I enjoyed taking blood, I enjoyed those aspects of the job. There were lots of aspects of the job that I didn't enjoy, like the fact that it was a full-time job, the fact that you have to, struggle to take time off when you want to take time off, the lack of autonomy that you sometimes have as a junior doctor. But overall, I actually had a pretty good time working as a doctor for 2 years.
Okay, so a couple of things. He mentioned here that he worked for a doctor for 2 years. So that's extremely junior in training. To put things into perspective, I'm a trauma surgeon. I did not get my position as a staff trauma surgeon until I had completed a total of 9 years of residency training after medical school. So, and even in the UK, the training programs can sometimes be even longer than that. So 2 years is really just scratching the surface. You're very much at a junior level. He did mention that sometimes you don't have that much autonomy as a junior doctor. And it makes sense, because the reality is that the level of experience you have after only 2 years of practicing medicine is small. you do still require supervision in most cases after 2 years of training. You need that extra help and support because you're not at that level. As a surgeon, you're going to need many years, 5 at least, 6, 7, 8 very often, before you're fully competent and fully secure in the skills that you're providing a patient. So without a doubt, the experience that you're going to have, the fun, maybe the lack of fun, for sure is going to be part of the process when you've only been practicing or as a junior doctor for 2 years.
Entrepreneurship stuff, I love the teaching stuff, but I also really quite enjoy medicine. And so what if I just do the medicine thing part-time? And so I made a video earlier in March this year, where I talked about how I'm going back into medicine part-time. And I did try it. I tried a few shifts. I tried working in medicine part-time, but I couldn't shake the feeling that every day I was in the hospital, I was thinking, okay, hour by hour, this is just nowhere near as fun as I would be having, as much fun as I'd be having if I were hanging out in the studio, hanging out with the team, doing this YouTube thing, doing the internet thing, reading, writing. I could imagine doing so many things other than being in a hospital treating patients in the emergency department. And that's just me. Like, maybe if you're a doctor watching this or a medical student, maybe you do genuinely find it fun. And if you won the lottery, you would still continue to work in the emergency department or whatever specialty you're doing. And if that's the position that you're in, then that's absolutely fantastic. The point of this video is not to convince anyone else to leave medicine. I'm just explaining the reasons why I'm personally leaving medicine. And
so I'm just going to cut him off there real quick. But I mean, that's probably the answer right here. You can go through that whole list. The bottom line is that compared to the other things that he's doing in his life, medicine just isn't as fulfilling for him. And I don't blame him. And that's actually a great reason to leave medicine. You're not going to find that it's going to fit perfectly for everyone. And sometimes people are a little afraid that, am I getting into the wrong field? I think some of the comments at the beginning of the video reflect that a little bit. People are a little afraid. Am I doing the right thing? Is becoming a doctor the right thing for me? It's normal to have those doubts. And if you have enough of an alternative set of experiences, for him, he's got 2 million plus subscribers on YouTube. He's clearly having an incredibly successful experience in front of the camera. So I don't blame him. At the end of the day, he's having immense success. And so that's probably truly the answer right here.
So now we move on to the big daddy number 3, helping people. Helping people is, for some people, a big part of why they do the work that they do, allegedly. But when it comes to helping people, I like to separate it out into two factors that I think are actually going on here. So that's firstly the personal joy that I get from helping people, which is one part of it. And then there is the actual helping of the people. There is a personal joy that we get from helping the patient in front of us, but if we think about it, is it potentially the most impactful thing that we could be doing with our time? I realized that the whole helping people thing, it's kind of a bit muddy in the water. Am I doing medicine because I enjoy the personal satisfaction of helping someone who's in front of me? Or am I doing medicine because I think the thing that I do actually has impact? And the way that I've become okay with this is recognizing that mostly actually it was the personal fulfillment. Because if I actually cared about impact, people have done studies that show how many lives an individual doctor saves in the course of their life. And depending on what estimates you look at, some say it's about 7 lives, some say it's about 28 lives, 30 lives, something like that. But it doesn't take into account the fact that if I were not a doctor, someone else would take my place.
He mentioned an interesting thing. He said some studies estimate that some doctors save 7 lives, some doctors might save 28 lives throughout the course of their career. So there's a lot to unpack there. And actually, this is the area that I took issue with. Some people have shown studies. I would love it if you have any comments in the below that you can put in. I'd appreciate it. But the idea here is that what studies say that doctors save 7 lives versus 28 lives or some quantified number? First of all, I can tell you from my own experience, without a doubt, that the number of people who I've done surgery on that would have died without surgery is far greater than 7. It was 7 last week. Now, obviously, I'm a trauma surgeon and an acute care surgeon. Our scale, it might be a little different, but let's say you're a plastic surgeon that does melanoma care. Every single patient that you're operating on, you're having an impact on their life. If somebody has melanoma and you cut it out, you have the chance to save that life. Now, exactly what the number needed to treat would be there, I don't know off the top of my head, but I can tell you right now A plastic surgeon cutting out skin cancer alone, or a dermatologist cutting out skin cancer alone, is saving far more than 7 lives. Even a family doctor that controls diabetes properly is saving lives. The problem is that you to figure out that number it's almost impossible, because when somebody dies, they die for multiple different reasons. So to put your finger on this was the reason why they died, and this was correctable, and the doctor did this X, Y, and Z, is a useless exercise. The fact of the matter is that people come into the hospital every single day with critical illness, and the healthcare system, the doctors, the nurses together work together to save those lives. We don't save every single one, for sure. There are many that escape our treatment, and they unfortunately do pass away or die, but many survive. And our emergency surgery board, that's full most nights in our hospital, is a list of people who, without surgery, and without medical care, if we just let the disease run its course, would die. So anyway, I'm really interested to see where the study comes from. I'd love to do a breakdown on this, because there's a whole bunch of weird studies where there'll be some statement that doctors kill more people than car accidents in a year, or some number like that. And again, I have to take a closer look at what those details really are. But in my mind, I suspect these are really like poor quality and methodologically like a problem.
In the UK, in most developed countries, and things like even like the National Health Service in the UK, there are enough doctors going around in the specialties that I'd be interested in, so such as like emergency medicine, where if I wasn't a doctor, if I didn't get into training in emergency medicine, the next person would have done. And so the system overall does not lose a doctor. And also, even if it did, when it comes to a developed world system, it's really the system that saves lives rather than the amazing prowess of an individual doctor. Yes, maybe if you're the world expert on some niche condition and you're the only person in the world, or one of a very few handful of experts who can solve the thing, then you are having counterfactual impact. You as an individual are genuinely making a difference. If you're a surgeon operating on this thing which is really difficult that maybe other surgeons couldn't operate on, you as an individual surgeon are actually making a difference. But
this is the problem here that I have with this whole video. The value that he's equating to being a doctor is this idea that you are special. And I understand. At 2.5 million subscribers on YouTube, there's a sense of feeling particularly special. Again, I'm a trauma surgeon, I'm a general surgeon. I do not walk into the hospital ever thinking that there is a surgery that only I can do. That if I wasn't on call, that something horrible would happen and patients would die because they didn't have the skills. In fact, the very fundamental core being of being a doctor is doing what other doctors would do. The situation where you have one sort of almost like a house, like Dr. House sort of skill set, the very idea that even exists is a complete misunderstanding of what it's like to be a doctor. Our job is to provide the standard of care. Our job is to do what other doctors would do in that situation. We are not in a place where we're supposed to be creatively solving new problems in medicine. There's a role for that in research, and I do some research myself. But the individual takes a back seat to the team. Again, I'm a surgeon. I might have the knife in my hand, but I thank the nurses in that operating room and the anesthesiologists every single time I operate, because without them, there'd be no chance that I could do anything. Medicine is a team sport, no matter who you are. And really, YouTube's a team sport as well. You don't do anything successful on your own. There's nothing big that can accomplish on your own. We can use extreme outliers like Elon Musk or Jeff Bezos and what they've accomplished. The reality is they did nothing without the help of other people. And as a doctor, as a surgeon, whatever you're doing, you are doing it with other people. And you should embrace that and enjoy it. And that's a really important thing, is to actually accept for your own self that taking care of other people and helping as a doctor is truly a team sport.
Being a doctor 2 years fresh out of med school, there was nothing special that I was offering to the medical profession other than the fact that I was a doctor 2 years out of med school. I wasn't particularly special. And so maybe if I'd continued training for 20, 30 years, I'd have become special. But at this stage of my life, I felt I wasn't having any real impact that me as an individual could have working in medicine. And the real reason that I kept at it was because of this personal joy and satisfaction of helping people, which the way I kind of think of the world in a fairly utilitarian sense, it didn't really justify it. I would rather not have the feeling of satisfaction and cause more impact than I would have a feeling of satisfaction and not have that impact, if that makes sense.
Doctors aren't Batman. We're not going around saving lives as individuals. It's not our individual uniqueness that makes us effective. It's the fact that we're working with other people, the fact that we're part of a team that makes us effective. And that's where we should draw our value, that we're working within a system to provide the best possible patient care experience that we can and ultimately help people. And that's what's worthwhile about being a doctor. My name is Dr. Richard Hills, and thank you for watching Knife Skills. Please like and subscribe. I'm going to be doing some more reaction videos. I'd appreciate any comments down below, anything that you would suggest that I talk about. If you didn't like this, you liked it, let me know. It's all helpful for me as I move forward with this channel. See you later.